Bismillahirrahmanirrahim. Today, just want to talk about another season of the brain talk, and this time we'll talk about the anatomy of the temporalis fascia, the temporalis fascia, and the three baths in this area. Actually, we do know a lot of operation in the frontotemporal area. Sometimes we use the Tyrian approach, and sometimes the front orbitozygomatic approach, and sometimes we do like any kind of decompressive craniotomy or craniotomy. So we must be careful in this area to injure a very important structure, very important nerves called the fascial nerve. As we see here, this is the facial nerves in these branches of the facial nerves going to the frontalis muscle and orbicularis oculi muscle, and injury to these nerves or these branches of the facial of the temporal branches of the facial nerve can cause disasters for some patient. So our goal in Tyrian approach or on the orbitozygomatic approach or any approach in this area, how to save these structures from injury. As we see, this is the picture as we see in our operation. How can we start our dissection in this area? So actually, in this area, we have some, confused about this anatomy. This is maybe for the inaccurate, understanding of certain structure. And also there is, many books, many researchers have their names for this area. We have not, one name or one calcification or just only this is for one book just only, or many books, or just only talking about one structure, one name. No, we find a lot of researcher, we found a lot of books giving us many names for in this area. So the exact name of this there is exact name or surname of the various structure. They're giving the same name for various structure in the temporal area. So we have here the story of the three baths. What if you understand the anatomy of the three baths, where is the fat baths? Actually, you can dissect very safe, and by this way you can just only prevent any damage for the facial nerve. So the first fat bath is actually the between the dense connective tissue and the superficial temporal fascia in the outside. The second fat bath is actually between the two layers of the deep temporal fascia. We have the superficial, we have also the deep layer of the deep temporal fascia. How this is the important very important fat bath to seek or to look for. So actually you can locate this fat bath by it's just only you can measure 4 to 5 centimeter from the lateral margin of the orbit, or another way, if you divide temporal muscle to 4 quarters. The first quarter is the important quarter where the second fat bath can find. Or the third way, you use your finger to finger breathe, so you find the exact location of the second fat bath. Here, our way is actually, this is the temporalis muscle. Here you divide the temporalis muscle to four quarter. The first quarter is the very important quarter, which you starting here, or where the superficial, the deep layer of the temporal fascia can divide to the superficial and also to the deep layer. So going to the third fat bed is actually between the deep layer of the temporal fascia and also the deep temporal fascia. Here, very a clear picture of the third fat bed. So actually, here is the this is the zygomatic arch. Here is the frontal process of the zygomatic arch, and here is the front zygomatic process of the frontal bone. And as we see here is the superficial layer of the deep fascia of the temporalis, and here is the deep layer of the deep layer of the deep temporal fascia, and here between them is the second fat bed here, and between the third here is the deep layer of the deep temporal fascia and the deep temporal fascia. Here we can find the second fat bed. I'm sorry, here's the third fat bed. Actually, here can we see this is another picture. This is the superficial temporal fascia. Here is the deep layer of the deep temporal fascia. Here is the third layer fat bed. Here is the deep temporal fascia. Here is the zygomatic arch. Here is the zygomatic process of the frontal bone here, and frontal process of the zygomatic. Here is, I'm sorry, here is the frontal process of the zygomatic or zygoma. Here is the zygomatic process of the frontal bone. As we see here, from here is one layer, two layer, and here also the third layer. Here is the deep layer of the temporal fascia, which divided to two. As you know, you remember this. We have here is called the deep layer of the temporal fascia. The deep layer of the temporal fascia is divided to two layers, superficial and deep one. And we have also the deep temporal fascia is a very thin temporal fascia on the temporalis muscle. Sometimes we cannot find this layer in some patients. Here, after removing the deep temporal fascia, here another very beautiful picture from the Chinese anatomy neurosurgery. As we see here, this is the facial nerve here. Here is the gallia. The gallia extends to the superior temporal line here in the level of the superior temporal line, and after that it continues as the superficial temporal fascia. And actually this layer, above this layer we have, it's called the dense connective tissue, and under this layer we have the it's called the loose connective tissue. And in this layer we will find the facial nerve in the superior temporal fascia. So our dissection during the operation, we're starting our putting the knife in the frontal side, and our knife reach the precranium here. In this area, we'll dissect with using the scissor, because here is the dissection area is very easy for us. Continue our dissection to the superior temporal line in this area. where is the in superior temporal line, or where is the pericranium? Continues with the superficial of the deep layer of the temporal fascia. So we're starting here our dissection in this area, and after that, cut in the superficial temporal superficial temporal fascia of the deep layer, and continues our dissection under. Here is the important thing here. You're going under the second fat bed. You're going under the second fat bed on the superficial temporal fascia, on the superficial of the temporal fascia of the deep layer, until you reach the zygomatic or the zygoma arch. So after doing this dissection, you will find as like this: the facial nerve and the superficial temporal fascia and the second fat bed, all of them in one layer. So by this way, you keep the facial nerves intact. Here also another very beautiful picture from the face trauma book. As we see here, he is the pericranium, sorry, and we're starting here our dissection in this area here, in the deep temporal fascia, here in this side, in the superior temporal line. Actually, we're starting in the superficial layer of the deep temporal fascia, and after that going to the beyond or under the second fat bed. So the important anatomy for us is the second fat bed. The second fat bed is the important area which keep the facial nerve safe. Here another also picture, as we see here, is the the third fat bed. Here is the second fat bed. The second fat bed actually is between the superficial and the deep layer. Where is the third fat bed? Actually is between the deep layer or deep temporal fascia of the deep layer, and also between the temporalis muscle or the deep fascia of the temporalis. And okay. We have three ways for dissection in this way to keep or to prevent the facial nerve injury. We have the first way, it's called the interfacial area. As we talked before, it's just only taking the superficial layer and with the fat bed or the second fat bed. By this way, we keep the facial nerve intact. And here, as it's the same interfacial, here the superior temporal fascia, which is just only connect with the gallia together. And here is the deep temporal fascia. This is the superficial layer of the deep temporal fascia. So you cut here this superior facial temporal this layer, and take it with the fat bed here as one layer. So by this way, we keep the facial nerve intact. Here is called the submuscular dissection. Take all the whole skin with the temporalis muscle as one layer. It's called myocutaneous flap. And lastly, we have also called subfacial dissection. We take all the temporalis deep and superior fascia as one layer and take it up with the fat bed, and after that we cut or the temporalis muscle or dissected the temporalis muscle or put it in the another direction, as we see here. So we'll talk about the interfacial, dissection, because it's very important for us, and we use interfacial, dissection, which used before by the Dr. Ghazi Sergio. So here are some anatomy points. The precranium here in the temporal region, at the level of the superior temporal line, continues as the superficial layer of the deep temporal fascia. It's very important, point here, because our dissection will continue in this layer. So dissection will be easy in the frontal side, and lastly, the deep temporal fascia is divided to two layers. Firstly, it's called the superficial layer, and also the deep layer. So here is our the operation here, and one example. Here is the craniotomy of the Tyrian approach. Here's the midline. Here is the our incision is coming from, or is coming from the nerve from the tragus, 1 centimeter, and coming to the other side. After that, we starting in the frontal side, because it's very easy to start in our dissection. And after that, we use the knife to start in our dissection in this area, because it will be very easy here to dissect the pericranium from the gallia here. And as we see here, as we see, is very clear dissection. And after that, we take the skin flap interiorly, and as we see here is the pericranium. Here is the superior temporal line. Here is the deep temporal fascia. So as we see, where we'll dissect, or where we'll cut the deep temporal fascia, or the superficial layer of the deep temporal fascia, how can you locate? So as we said, we use like a ruler, and it's just only measure 4 to 5 centimeters from the lateral margin of the orbit. This is the first way. The second way, use your finger breadth to estimate your cutting dissection. And the third way is how to divide the temporalis muscle to 4 quarters. The first quarter is your goal to starting your dissection. Here our cut by knife, starting in this area. It's called interfacial dissection. Here is the deep layer, or superficial layer of the deep temporal fascia. Here is the superior temporal line. Here is the pericranium. And as you see here, we're starting our dissection until we find the second fat bed. The second fat bed actually is here, and we take also the fat bed with the superficial layer of the deep temporal fascia. Actually, we forgot to talk about the first fat bed. Where is the first bed? Actually, the first fat bed is actually in the between the gallia, and between also the between the gallia and the superficial temporal fascia, and and also between the skin. So there is skin and gallia and superficial temporal fascia in this area. So never go into the first fat bed, because there is the facial nerve there. There is the vascular there for temporal, artery, for temporal vein. So be careful. Here is after we do like interfacial dissection, we cut the pericranium in this way, and fix it with the skin flap. And here as our last picture, or last our dissection picture, the temporalis muscle just only reflected to the another side, and leave a cuff of muscle here to restore it when you finish your operation. So by this way, we talk about, the very important, temporal fascia between and also the story of the 3 fat baths. The important fat bath will be the second fat bath. So temporal fascia is actually, there is, it's called the deep temporal fascia, which is divided to the superficial and deep layer. So we're starting our dissection actually in the superficial layer of the deep temporal fascia with the second fat bath and reflected anteriorly, whereby this way we keep the facial nerve intact without any injury. Thank you so much for your attention.